only ask one question. If there are remaining questions in the queue when we're done and you feel your question hasn't already been answered, you can submit your questions in the chat or by email, and we'll get you a response in writing. We will begin in just a few moments after we grant recording permissions. Okay, I believe all the permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. And if you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. I'd like to begin by reviewing where we stand at the moment in regard to respiratory virus activity here in Ohio. Fortunately, our COVID-19 and RSV numbers are both declining from the levels that they had reached in January. We were seeing 10,000 or 12,000 COVID cases a week earlier this year, while we're now down to about 7,000. Hospitalizations have declined as well. Periodically, reports of new variants have caused concern, but so far, each of these new variants has not been causing an increase in levels of severe disease. The variants have all been subvariants of the Omicron lineage, the most recent being JN1, which accounted for more than 3/4 of COVID infections in Ohio on January 27th, which is our most recent variant data. It's important to note, though, that this disease is still claiming lives of Ohioans every single week. If you've not been vaccinated, particularly if you're over the age of 65 or immunocompromised, please get the vaccine. It could save your life. We didn't see as large a surge in RSV cases this year as we did last year, but we did see a substantial surge of cases in December and January. That increase has since receded. Overall, influenza activity in Ohio this season has not been unusually high. In fact, the numbers are right on track with our 5-year averages statewide. But while flu activity has been declining in January, recently it has increased again. And ODH characterizes flu activity now as actually very high in Ohio. Therefore, we need to use common sense precautions, such as if you're feeling sick, stay home from work or school and stay away from others. And if you are not yet vaccinated against the flu, it's not too late to get the vaccine and protect yourself and protect others. Now, COVID-19, RSV, and the flu aren't the only infectious diseases in which we need to be protecting ourselves. We have an array of traditional vaccines that protect us from a variety of illnesses that many of us may incorrectly think are long lost to the past. The reason we give routine vaccinations is to protect us from organisms that, though much less common today, are still around and are still a threat. We've had a few examples in the past year or two of historic illnesses making their way back into Ohio and causing unvaccinated Ohioans to become, in some cases, very severely ill. We had an outbreak of measles, largely in central Ohio, in an under-vaccinated population in late 2022. Out of 85 cases, sadly, 36 of them were severe enough to require hospitalization. You've likely heard about a sizable outbreak of measles in Europe, particularly right now in the United Kingdom, where they have reported a large outbreak. And here in Ohio this year, we've seen 3 cases in Montgomery, Richland, and Miami counties. Now, one of the common features we're seeing in these cases is that the persons infected are not adequately vaccinated. This just underlines how important getting your routine vaccinations is in a global environment. International travel means an outbreak in one country can reach another country when there are under-vaccinated populations in that country very quickly. The measles vaccine, which is combined with mumps and rubella and called the MMR vaccine, is highly effective after receiving the recommended 2 doses. For those of you who live in a community where we're seeing cases and where public health advisories have gone out, if you believe you may have been exposed and you have not been contacted by your local health department, please reach out to them. And for much more information about measles, you can go to the Ohio Department of Health or Centers for Disease Control and Prevention websites at the links we will now post in our chat. 2 other vaccine-preventable illnesses that we've seen in Ohio recently are pertussis and meningitis. Pertussis, or whooping cough, can be very serious, particularly for infants. Again, people may think whooping cough is just a part of the past, but last year we saw an increase both nationally and in Ohio. In Ohio, we had 810 cases, our highest number since 2014. And so far this year, there have been 105 cases reported. We had a meningitis outbreak in Ohio last year also. The meningococcal vaccine is required for all Ohio students entering grades 7 through 11, and a second dose is required prior to the 12th grade. If you're unsure of the vaccine status for you or your children, please consult with a healthcare provider. Following the recommended vaccination schedule really can protect you and your family and truly help make these diseases a thing of the past. I want to talk now about another infectious disease that we are sadly seeing resurgent in the United States, and that's syphilis. Rates of syphilis have been rising over the past 4 or 5 years at an alarming rate, both nationally and here in Ohio. Now, unlike other diseases that I've discussed today, there is no vaccine for syphilis, but there are very effective treatments. Everyone should be aware of the increasing prevalence of syphilis, but I want to draw particular attention to the danger of congenital syphilis, where an expectant mother, in the case where the disease is not identified and treated promptly, can pass this on to her infant, resulting in some very serious consequences. Congenital syphilis can cause a miscarriage, premature birth, or even lead to stillbirth. Infants who acquire syphilis through their mother can suffer a host of complications, from deformities to brain and nervous system issues, including blindness and deafness. The Ohio Department of Health is working hard to provide more access to testing and treatment for syphilis, both congenital and otherwise. For pregnant women, providers should screen for syphilis at one of the first prenatal visits and then again later, between the 28th and 32nd weeks of pregnancy. This window allows a provider to catch an infection that may happen during pregnancy, and yet, with enough time to diagnose and treat syphilis infection before birth, preventing a case of congenital syphilis. With prompt diagnosis and treatment, serious injury from this disease can largely be avoided. Now, I'd like to turn to the topic of lung health. For decades now, Americans have been told that smoking cigarettes is harmful to your health. Governor Mike DeWine and the Ohio Department of Health have made smoking cessation a centerpiece of our public health efforts, and we've been pleased to see the state's adult smoking rates drop from 25.5% in 2011 to 18% in 2021. However, that rate is still too high and ranks Ohio above the 2021 national average of 11.5%. In recent years, we have focused increasingly on combating the rise in the number of Ohioans, in large part youths, using e-cigarettes or vaping devices. Because these devices don't have smoke and the tar that is associated with smoke, they may be seen as less harmful, but they're not benign. I think we need to keep in mind the fact that any foreign substance that we're inhaling into our lungs, other than a prescription medication, say for asthma, is really not a good idea. Whether it is smoke or a vape, we're introducing foreign substances into our very sensitive pulmonary tissues, substances that don't belong in those tissues. And we need to be considering the potential adverse effects of bringing those things into our lungs. And now, to help us better understand this and to further explain some of the dangers of smoking and vaping, I want to introduce two guests I'll be speaking with today. Stephanie King is a certified family nurse practitioner and clinical nurse coordinator of the asthma clinic at the Cleveland Clinic. Stephanie is also a member of the American Lung Association's Cleveland Local Leadership Board. And Dr. Peter Shields, Emeritus Professor of Medical Oncology and Cancer Prevention at Ohio State's Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. First, let me turn to Mrs. King. Most Ohioans are probably aware of some of the risks that are associated with smoking tobacco, but they may not be as aware of some of the risks of smoking other substances and or vaping. Can you talk a little bit about some of the risks associated with using smoking or vaping products generally?
Hello. Yes, I can actually speak to that. The word is called EVALI, which is e-cigarette vaping associated lung injury. In addition to what Dr. Vanderhoff has said, inhaling anything causes that immunity inside the tissues of the lungs to cause injury. It decreases our lung function and it alters immune responses critical for our lung function. Some of the signs and symptoms is shortness of breath, hemoptysis, hypoxia, which means people are not getting enough oxygen. One of the most concerning things is because e-cigarettes have been around since the mid-2000s, we don't have long-term effects, but we do know there was a big increase in the epidemic of e-cigarettes that caused multiple hospitalizations leading to interstitial lung disease, as well as other injuries to those lungs.
Thank you. Certainly some very, very serious things to be thinking about. Dr. Shields, most people know there's a cancer risk associated with cigarette smoking. Could you talk a little bit more about that risk and about any emerging science or about the potential cancer risk of smoking other substances and or vaping?
Sure. Let me break that down into two parts. So I'll talk about smoking cigarettes, a combustible product that would also include cigars, and vaping. And then we'll talk about inhaling things like cannabis, whether that's vaping or using it as a combustible product. So smoking, of course, everyone knows is a pretty deadly addiction. And smoking as little as one cigarette a day increases lung cancer risk. Environmental tobacco smoke, which is a much lower exposure, increases lung cancer risk. So that's something that absolutely needs to be dealt with, and quitting smoking at any age, even after you're diagnosed with lung cancer or heart disease or stroke, has a benefit. So that can't be overemphasized. Then we have vaping with electronic cigarettes, causing a huge epidemic of nicotine addiction and use among youth. That seems to be better under control now, given the massive public health campaigns. And so a major issue still remains relative risk. So vaping, as you said, is not a good idea. Putting anything into your lungs that's not supposed to be there is just not a good idea. So anyone who claims that vaping is safe is really doing a disservice. The question is whether it's safer than smoking. And I think there's a lot of data for that, including ours at Ohio State. There was just another huge, high quality study published last week in the New England Journal of Medicine saying that vaping may be a better cessation tool for smokers compared to nicotine replacement therapy. Still not a recommended process, but more and more organizations are saying, well, if people insist on vaping versus smoking, then you got to work with them. And so we might be seeing differences in the future. There's a lot of evidence for that. But again, it's not safe. It's not good to be initially used by youth or young adults, which is usually where they start and get addicted. As far as cannabis, smoking cannabis, that's a combustion product like smoking. The studies are not as good about causing cancer risk, but those that are there certainly are suggestive. There's no reason to believe that smoking marijuana or any product like that is not going to be or will be equivalent to cigarettes. In both cases, quite frankly, it's like putting your head in a fireplace. And so then you get into vaping marijuana. Well, that we don't really know much about at all. We do know, as Ms. King mentioned, EVALI was an issue, probably related to what drug dealers were literally putting into the vaping liquids, which was vitamin E acetate. So in the end of all of this, whether you're vaping cannabis or vaping nicotine, we really don't know the long-term health effects. And, we could wait 40 years to see who's going to have lung disease or cancer or whatever, or we could address it now and do our best to keep people away from those products.
Thank you very, very much. Well, as I wrap up, I want to direct people to the many resources that are available for smoking and vaping cessation, vaccines, and where to go to find more information on the topics that we discussed today. First of all, the Ohio Department of Health encourages anyone who wants to quit smoking to call the Ohio Tobacco Quit Line, and that number is 1-800-662-4357. It's important to know that when you call that quit line, you're not going to get an automated message directing you to resources, but rather you'll be talking to a real live human being who's an expert on this topic and can provide you with very active support. There's also a resource just for young people who want to quit smoking or vaping called My Life, My Quit. And that can be accessed by texting Start My Quit to 36072 or through the website that we're going to post in the chat here now. We also will post links to other resources, such as information on syphilis from our ODH website, where to find COVID vaccines, and more information on immunizations. The ODH immunization page includes the schedule of vaccines that are required for school attendance here in Ohio, as well as the schedule of when children should receive those vaccines. It's my hope that Ohioans will take advantage of these resources and use them to help stop smoking or vaping and to get and stay up to date on vaccines that can prevent serious illnesses. The goal is to make choices that will lead to better health and better lives for all of us in Ohio. Thank you. And Ken, I think that we're ready to move to taking questions.
Okay, thank you, Dr. Vanderhoff. A reminder to please only ask one question today. And our first question is from Joe Ingles, Ohio Public Radio and Television.
Good morning.
Hello.
Hi.
How are you? Thank you for having this.
Yes.
I wanted to ask, a lot of people have been asking me that if you've had the measles vaccines and you are around someone who has measles, are you protected? Or is it like COVID vaccines where they just, help protect you from maybe dying from it or something like that? Can you explain that link?
Yes, I'd be happy to. And it's an excellent question. The wonderful thing about our vaccines for measles is they are very, very highly effective. And they're very effective at keeping you from even getting sick. So that for the most part, those of us who are fully vaccinated really are deeply protected against measles and measles illness. Now, of course, nothing in life is 100%. And even though this vaccine is extremely good, and one of the risk to a vaccinated person following an exposure is extremely low, from a public health point of view, we still ask them to carefully monitor themselves in cooperation with their local health department and their healthcare provider for about a 21-day period, just to be sure they aren't developing symptoms. And during that time frame, to be extremely careful in that monitoring. But yes, if you're fully vaccinated against measles, you're in a very good position in that regard. One of the other things that I'll note, and this is just an indication of how good that vaccine is, from an epidemiologic point of view, measles was actually eliminated in the United States in 2000. And what that means is we had a documented absence of continuous disease transmission for more than a year. And there's no question that this was a very direct result of our highly effective vaccination program here in the United States. And it really points to the tragedy of the ongoing outbreaks that we're seeing both here in the United States and internationally of measles, because what is clearly happening is that it is creating trouble within communities and among people who are not adequately vaccinated.
Okay, our next question comes from Nick Foley, WHIO TV.
So, Dr. Vanderhoff, you have spoken about the efficiency of those vaccines and what they can mean. But the truth of the matter is we are seeing more unvaccinated folks in the state than we have in a long time. So for those perhaps that are, not vaccinated, can you maybe perhaps elaborate on the dangers of measles and why it's so dangerous, because of how long it takes to maybe show symptoms and what can happen when someone travels during that time?
Yes. So one of the things that we need to be aware of is, and I've said this so many times, we live in a global community. International travel is a part of the modern world. And that, in some circumstances, may mean that we ourselves are going to travel abroad. In other circumstances, it means, here in the United States, we have visitors all the time who may inadvertently be bringing one of these vaccine preventable illnesses into our community, or we as travelers may be exposed inadvertently in our own travel. The blessing of our vaccines is that they have been proven to be very effective and very safe. And what we're seeing now across the world with these outbreaks of diseases that are very preventable with vaccines is truly a tragedy, because what we've done is left ourselves vulnerable. Take, for example, the current concern about measles. Measles is a very serious illness. It causes people who get it to become extremely ill, and in many circumstances end up in the hospital, and in rare circumstances we even see deaths from measles. Think of what a tragedy that would be in any one of our families, where members of our family to come down with what we know is a vaccine preventable illness. But there are many other examples. I shared about pertussis. Whooping cough is also highly preventable with vaccine. And I could really go on down the list. In the MMR vaccine that prevents measles is also a vaccine that helps prevent mumps. And what I think people have forgotten is that mumps can be a very bad illness leading to infertility in people. So all of these vaccine preventable illnesses are illnesses that really were feared by previous generations. And I think we've been lulled into a degree of complacency, forgetting just how important these are and forgetting that they're not gone. And I'll give one final example, polio. I think we all know how devastating an illness polio can be, leading to paralysis, and other serious consequences. Polio is not gone from the globe. So one more example of an illness that we need to protect ourselves and our families from, with the benefit of modern vaccines.
Our next question comes from Jim Provence of the Toledo Blade.
Morning, Dr. Vanderhoff. Thanks again for this.
Yeah.
You were talking about syphilis, and I'm curious, I mean, has the state seen a corresponding increase in the rates of other sexually transmitted diseases like HPV, for which there is a vaccine, or HIV, gonorrhea, et cetera? Is there a reason that syphilis sticks out?
Yeah, it's really difficult to determine the exact root causes that are contributing to this national increase in syphilis. As you noted, it is a sexually transmitted disease. There are a number of factors that may be contributing. Certainly, there are concerns about its potential link to drug use in the United States. We also know that there have been challenges in some parts of the country, in the state, in terms of testing and treatment in a timely manner. And so all of these factors may be playing a role. The other thing to keep in mind about some of these diseases, including syphilis, is that it's frequently misdiagnosed in its early stages because the symptoms of syphilis can mimic many other conditions. And in fact, it's often referred to as one of the great mimickers. So it's important that we be thinking about the risk of syphilis and screening for it at important times. One, of course, as I mentioned, would be during pregnancy, but also thinking of it as one of the sexually transmitted diseases that we test for in situations where we are, as clinicians, working with our patient and concerned about the possibility of sexually transmitted diseases. Now, one of the things I want people to be aware of is that the Department of Health is working very aggressively to address this increase. And I don't have time in answering your question to go through an exhaustive review of that, but I would like to highlight two ways that we are very actively engaged in that work. One is that we are working extensively with medical providers and provider organizations to screen for syphilis in pregnant women, not just at one of the first visits in pregnancy, which has been a longstanding practice, but again later in pregnancy between 28 and 32 weeks, because we know that syphilis infection may be silent even though it's there. That window allows a provider to catch an infection that may be occurring during pregnancy, yet with enough time to treat that syphilis infection before birth, preventing a case of congenital syphilis. Another way that we are leaning into this is that we are providing free medication treatment for anyone who resides in Ohio who may be underinsured or uninsured. We have over 100 sites currently involved in this program that include local health departments, nonprofits, academic health centers, and jails. And as a part of this effort, our syphilis disease intervention specialists from the department are able to even bring the medical treatment called bicillin out into the field to ensure that any provider is able to get this very important medication to patients in a timely manner. And we've actually received national recognition for that work.
Okay, our final question today comes from Laura Hancock of the Plain Dealer in Cleveland.com.
Morning.
You there, Laura?
I'm sorry, I'm doing two things at once. I was just wondering, with marijuana, I mean, do you guys expect, I don't know, do the physicians and the nurse practitioner, do you guys expect a lot of people coming in? Now that we've got marijuana legal, you can grow it at home, and pretty soon there'll be dispensaries open selling flower that people can, smoke. I was just wondering if this is an increased concern at this time.
Yeah, so I think that the message that we're conveying here is that lung health is not something that we can take for granted. And we all have to be thinking about caring for our lungs, just as we think about caring for other parts of our bodies, including our hearts. And that we need to be very mindful of not unnecessarily exposing our very sensitive lung tissues to foreign material. And there are risks that we believe can be associated with any form of smoking or vaping. Let me turn to my guests and see if they have anything they would like to add. Let me start with Mrs. King.
Hi. I actually agree with that. Anything we smoke will turn into hazardous vapors in the lungs, and pulmonary wise, we always educate about lung health and ways to prevent those long-term lung damage. And because I do work in an asthma center, we do actually promote that education among our asthma patients and COPD.
Thank you. And Dr. Shields, anything that you'd like to add?
Yeah, I would just add, because I take care of lung cancer patients at Ohio State, and a lot of them are using medicinal marijuana. So it's been around a while. And there's always that strong recommendation is don't put anything into your lungs. Seems pretty obvious for a lung cancer patient, but there are other options for those people who want to make those choices and now can legally make those choices. Then there's edibles as the option. I'm not saying that's safe, but at least it's not going into your body through your lungs.
Thank you very much.
Okay, thank you for joining us today. And Dr. Vanderhoff, do you have any closing remarks?
Thank you again for joining us. Thank you for your attention to these very important topics. We have, I think, a real opportunity to get some important messages out that could help improve the health of Ohioans, and I appreciate your attention. So thank you.
All right, this concludes today's press